Hello all, welcome to the Meet the Physio series. As part of today's discussion, we have Dr. Srividhya Kesavan. She is a consultant physiotherapist with more than 10 years of clinical experience. Welcome to our show, Dr. Srividhya.
Thanks, Arun. Thanks for having me.
Sure. We can get started. I want you to give a little bit background about yourself in terms of your career so far.
Sure. So I completed my undergraduation from Ramachandra University, that's in Chennai, and post-graduation from MS Ramaya, Bangalore. Then I went on to have hospital experience from Kaveri Hospitals, and then I worked in outpatient centers after that. So some of that was in the US, where it was a predominantly adult and pediatric neuro rehab center. And then back in Chennai, I worked with Pain and Stroke Rehab Center, which was adult ortho and neuro. Okay. So post that, since 2021, I've been having a practice of my own, which is a home health care practice. Okay. So right now, I'm doing adult and geriatric ortho and neuro rehab. Okay. So this is.
So your experience spans across geographies, from US to India. So what is the biggest difference that you see when you compare a physiotherapy practice in US to what is in India?
So practice wise, I feel that the standards of practice are similar in the US and in India. But the difference that I saw is the extent to which the rehab is continued. So I saw that in the US there is a necessity to become independent. And so the rehab continues until that phase happens. Sure. But in India, we have a larger support system for patients. Okay. And so the rehab often gets limited in terms of their independence, and there's a lot of help from family members. Sure. And helpers. So that was the difference. So the rehab focusing, end goals of rehab become then different.
Okay.
Yes.
Okay, that's nice. So now in your practice you probably focus more on the home visits and the home care. So what is one thing that you think you are doing special, or that you want to say, okay, this is something that you are doing something different?
I think what I do differently is taking into account the real scenario of the patient. Okay. So when there's a home exercise program that's to be given, I can't just give them a list of 10 exercises or 15 exercises and say, do it, come on. Sure. But if that person is, say, having a full day of work, having a full-time job, then he's surely not going to find the time to do it. And that often puts them at a disadvantageous position at the beginning. So I think something that I do differently is to actually have the conversation of, hey, buddy, what's your time limit? How much time do you realistically have to exercise? And sit and plan with them that these are the most important exercises. How can you get it done throughout the day? Okay. And when sometimes even specifically, morning, let's do this exercise after this routine, or evening when you get back just before you're going to bed, let's do these exercises. So it's almost like a plan is already there in place for them, and it's easily broken down, so it sets them up for a success to plan out their home exercises.
So you try to keep this rehab as part of their daily routine, so they don't feel this as something different than their
it shouldn't be. Yes, it shouldn't be. Otherwise, then it's difficult to keep it up.
Sure, makes sense. Okay, what is one thing that you are very proud of in your practice so far?
Yeah, so one thing that I'm proud of in my practice would be, I think, that I got to have a varied experience. I've in different setups. So I've been in an outpatient setup, I've been in a long-term rehab setup, inpatient and ICU, acute care, and pediatrics as well. Sure. So I've gotten to take the best practices from each place and incorporate it into my practice. So I think that is something that I feel good about.
So, what is one condition that you feel is your favorite condition or that you feel most comfortable treating, saying, okay, this is something that I can really do?
Okay. I think anything to do with the spine,
Okay.
especially low back pain,
Sure.
that's been always my favorite. Especially if it is a nerve involvement, then I like the condition and I like the solving the puzzle.
Okay. Yeah, I mean, this low back pain is a very prevalent condition
Yeah.
among the young adults. So, can you briefly say what are the typical causes and
Sure.
how do you address it?
Yeah, sure, okay. There is a lot of variability when it comes to low back pain. The at least the features or the symptoms vary from something simple localized low back pain, and it might be a short duration one, and or it might go into radiating pain or pain radiating to the thigh, or maybe sometimes pain radiating to the leg. And in the other spectrum, I mean on the other extreme is numbness, weakness of the leg, and so on. So when the clinical features are varied, then I think some of the causes for, I think what we see most commonly is this mechanical low back pain. So in mechanical low back pain, if you are talking about young adults, having low back pain, then most of them are due to a certain, not posture related, but I think lesser movement opportunities.
Sure.
So there's no one good posture, and even if you sit in the most ideal posture for a very long time, it is still going to hurt, right? Even if you have the best ergonomic chair, no matter what. So I think finding opportunities to move frequently then becomes the answer there. The other side is the weekend warriors who will not do any kind of preparation and then go and play a sport or do extreme yoga on one day. And then I think that puts some pressure on the joint, where anything that is either unaccustomed activity, where you're not used to a certain activity and you do it, or too much in too short of a time, after doing nothing, or too less for a long duration. So these are the two broad classifications of why people have low back pain.
Okay, so you have been practicing for over 10 years now. So if you were to start today, what would you have done differently when compared to what has happened over the last 10 years?
I think along my journey, before I started a practice on my own, I second guessed myself quite a bit. So I think I would start earlier and accept that learning is always on the go, and not just I have to learn. There is an end point to learning and a beginning point to starting a practice. So I think that is starting earlier is something I would have done differently.
Okay, nice. And what is one challenge that you can highlight in your physio career so far, and how did you overcome?
I don't know if I overcame, but the challenge I think is getting patients to see the difference in traditional medicine and physiotherapy. So medicine you are given a few pills and then it's a few seconds of work that you need to do and then it's done. So the pill takes care of everything else. But in physiotherapy, it's so that I would say it's more of a passive form of treatment. Whereas in physiotherapy, you have to really put in the work. So a physiotherapist can guide you and help you to do the right kind of exercises, or tell you this is how you can modify your posture and things like that. But unless you are actively doing the exercises again at home and doing the other things right in terms of taking your movement breaks or finding opportunities to move, exercising regularly and things like that, it's difficult to change physical parameters. So that takes a lot of effort, lot of habit formation and lot of thought from the patient's side. So I think that mindset change has been the biggest challenge. I don't. It's difficult to overcome it overnight, but it's a work in progress.
Okay. So, what is one feedback that you have received from a patient that has made you very happy?
I think the feedback that made me very happy is when there was a a client with low back pain. She had low back pain, radiating pain, and the whole thing. And she was constantly wearing a belt. She had to actually start working from home. So she stopped going to office because of the low back pain. So when she came for therapy and the pain started to get better, so while she was doing the exercises on the treatment table, she mentioned, maybe if this pain reduces, then once the pain reduces, then even I can go back to work in person. So I think I could see that she was being hopeful and she was looking forward to making a plan, making a goal for a pain-free life, and that was the best feedback that I received. So.
Okay. Do you really think a clinical management platform or a software is needed for the physiotherapist rather than relying on just pen and paper?
Definitely, if compared to pen and paper, there is a need for software. But especially when you're having a practice, see, if you're working for somebody else, like in a hospital, then you need to go see patients, write notes in the chart is already there, and you don't have to do anything. Your job is only patient care there. But if you have a practice of your own, then you have things from getting enquiries and then making a note of those enquiries, following up of those enquiries. From the patient comes in, there is a journey. And then you have your maintenance of your space, maintenance of your therapists, and then there's patient care itself, where you have to maintain records, maintain notes, and give them periodic progress notes and records, and then give them receipts for their payments, make sure that the payments have been on track. If you have a practice, especially where you have outpatient, you have inpatient, if you have home visits, then if you are having about 20 therapists and they are spread across, then you need a better system of managing, rather than every time picking up the call, and checking, have you gone for that visit, were you on time, or what's happening now. So I need a place where I can see all the information in one go. So that brings, I think, a necessity for a clinical management platform in physiotherapy, for sure.
Okay. And we know you use Able Pro for more than a couple of years now.
Yeah.
So what is one favorite feature in Able Pro that you think have made a big difference to your practice?
I think just the appointments itself. I can't. It's difficult to pick one. First of all, so I can give you two. So one is the appointments itself, because as soon as I schedule an appointment, the reminder goes to my patients. So my patients have now learned to rely on those reminders. For them, if the message has not gone saying that, hey, you have an appointment today, then they'll call me up and ask me, are you really coming? So that is one thing. And secondly, I've had situations in the past where I've gone to a person's house for a home visit, and then they said, I forgot. So that is not very, sure. In a clinic, no show, it's different. But when you are traveling for a home visit, then it becomes very cumbersome. So because these reminders are there, then they can call me and either they can be prepared for the appointment, or if they need a cancellation or a reschedule, then it's easier for them to reschedule it then. And I think the second feature that I personally like is the receipts feature, because as an independent practitioner, not being attached to a clinic or a hospital, it's easier for me to give my patients insurance compliant receipts, so they can use it. They've used it in many places, and it has been easy for them to keep track of the appointments and their payments.
What would be your advice to the budding physios and people who are just starting out straight out of the college?
For clinical practice?
People who want to, ultimately the goal would be to have a well-established practice on their own. So what would be your advice in terms of how to plan their career?
At least this is of course me. I would say that get into patient care first. So learn patient care and learn all the different aspects of it. So diagnosing, treating and prescribing exercises, making sure they're doing it is definitely one part. But there's a lot more that goes into patient care, as in communication. So communicating the need for the exercises, educating the patient on the condition, effectively communicating so that the patient feels comfortable with you, because it is a relationship that you need to maintain. So I think in those terms we need some mentoring. So how you put across your diagnosis, the contributing factors from their life that you think are leading to pain. So all that also needs some amount of good communication skills. So I think if you ask me, I would say go learn on the job first. So learn all the other skills that are associated with patient care, and then you can surely start out on your own in a more confident manner. But if a person is, say, confident enough to start by themselves, anyone with the means to do it can do it. And always, for sure, patient care also, and business management or practice management involves a lot of learning on the go. So it has to have a daily learning and a reflection. So if that is the case, then I think the practice needs to be value based, where you define the key values that your organization or practice should hold, and then work backwards in terms of how are you going to establish it. So in terms of patient care, continuity of care, relationship with therapists, relationship with patients, and many other facets that are involved.
Sure. If I were to ask you to explain about your practice in 5 words, what will those 5 words be?
5 words. Okay. I think patient-centric, goal-oriented, evolving, reflective.
Okay.
Lots of fifth word.
Sure. I think that's fine. Sure, I think this is very good. And thanks, Srividhya. Thanks for your time today.
Thanks for.
And I wish you all the best.
Thank
for
you.
your future plans.
Thank you. Wish you all the best too.
Yeah, thank you.